Hello, everyone. Happy afternoon and welcome to today's YouTube live session where we have the best of our educators, Dr. Preeti Sharma and Dr. Bharath here for the most important subjects, I think, that are in our MBBS curriculum. So, hi to all the second prof students here. If you are disoriented how to, tackle the most important subjects of your medical curriculum, we are here to guide you. And so happy afternoon again, and happy afternoon to you as well, Preeti ma'am and Bharath sir.
Thank you, Dr. Nikita Nanwani.
Thank you.
Happy afternoon.
Yes, so I'm pretty sure that the viewers are very much excited about this session, like I said, because we have pathology, pharmacology, and microbiology. I think they form the foundation of our medical learning. And I believe it is the most important year in MBBS is the second year. So we are here to guide the students on how to make the best of the time that they have in their second year of the curriculum and how we can help them in the best possible way. So talking about the standard textbook versus the videos. So, Preeti ma'am, I'm pretty sure that when it comes to second year, you know that second year, matlab the standard textbook, like Robbins is something that comes to everybody's mind, right? But I also know that as soon as a student picks up that book, सबसे पहले is the fear कि अरे ये कब खत्म होगा, एक साल में तो होने ही नहीं वाला है. That is the fear that's there. True. So it's very, very difficult, to assimilate, or a student who's starting new might not read Robbins again, in the beginning itself. So what is your take on that? That how can they read the standard reference textbook, and how can our videos help them in grasping the reference textbooks in a much easier way?
Right. So I think, ma'am, you put up a very valid question, not only for pathology, but also for micro, and eventually Bharath sir will also address that for pharmac. Because when it comes to standard textbooks, especially Robbins, I think that is a book which all of us in our times, we've been scared of it. We all have had a phobia of that textbook, and that continues till date. And students, even now, do somewhere run away and find an escape of how to find a shortcut to that textbook. So first and foremost, my cliche answer will be that you cannot escape from that textbook, and no matter how much you may dislike it, you will have to study it. But how we can help you in this journey is that we can simplify that textbook for you. So the way I have recorded the video lectures, be it Robbins based for pathology or Anantnarayan and Baweja based for microbiology, if you pick up the videos, they are arranged in the same sequence as the chapters that are put up in these textbooks. So how, if I would have been a student at this point of time, how I would have approached it would have been that I would have picked up, say, for example, chapter number 1, cell injury from Robbins, and chapter number 1, cell injury from the video lectures. And I would have gone through the lectures with Robbins open on the side, so that as I'm listening, see, when we listen to video lectures, we do get to know that, okay, 85 to 90% of Robbins is covered. And these are all the important things that I wish to convey. And these are the things that you have to study. Now, after that, when you get down to reading the textbook, a lot becomes simpler. Actually, Robbins is not a textbook which is very difficult. It's sometimes the language which makes the textbook a little difficult. You know, every line, even till date, I say that whenever I read Robbins, there is always a new sentence that I feel that comes out of that book. So it is that kind of a magic book that as many number of times you'll read it, more knowledge you're going to gain out of it. And that becomes very difficult for a second prof student to actually simplify. So my advice would be that all the lectures are arranged on the Robbins pattern. As you are listening to the lectures, after you listen to it and you go through our notes, just scan through Robbins once. And if you feel anything is extra from your university point of view, if at all, maybe there is a short note, or maybe there is a question which your prof examiner really likes to ask and has asked repeatedly earlier, just pick that up and add it into your notes. So that way you are making a mini Robbins of your PrepLadder notes, and side by side your videos are also getting completed, and that phobia of Robbins and other books are also getting out of the way.
So you mean here that the printed notes that we provide come Correct. To rescue as well?
Yes.
Okay, that's great. And yeah, for the students who don't know, so Dr. Preeti is our educator for both pathology and microbiology, which are like two major subjects. And she simplifies the subjects in the easiest way possible. I'm sure you must have seen her videos, and I'm sure there would be nobody who does not love Dr. Preeti here. And the same goes true with Bharath sir as well. The way he simplifies pharmacology. We have seen quite a videos, on our PrepLadder YouTube channel as well, coming up the short videos with the mnemonics that are coming up. So thanks to both of you for simplifying these major subjects. Coming over to you, sir, regarding pharmacology. Right. Again, another dreaded subject in the second year. And, majority of us, we know that we read the standard or reference textbook like KDT but for some, the extraordinary students, they also read CATSM. So what is your take on that? How our video lectures are a perfect amalgamation of both the textbooks and the content that is required for the students?
Yeah, thank you, Dr. Nikita Nanwani, for that question. And really, when I was in second year, I used to fear for the second year subject till now. So the pathology, the microbiology, and pharmacology, and we also had forensic at that time. So every time I opened the KD Tripartite, it was like huge information. Now, I never knew where to start and where to end that and how to remember the drugs. So what we are providing in the videos is a concept-based approach where if you take an example of peptic ulcer disease, we'll be starting with what is the disease, what is the physiology of acid secretion, and what is the aim in treating the disease, and then we come to the drugs. So you will build a concept with that, and you will understand pharma in a better manner. Now, what happens in textbook as such in KD Tripathi, he'll be giving every drug in 5 lines, 6 lines. So the student gets scared with that. So the information is plenty. So our purpose here is to give the valid information. So once you go through the videos, whatever in-depth understanding you want, go to the textbook. So that is what you can do with the approach, particularly in second year pharmacology. And also most of the videos, what we have done is we have started with a clinical case or an MCQs, and we have winded up the video with the revision part. So that will help you in quicker revision. So that can be done. Go with the videos and read the textbooks later. So you will get a concept that will be there retained for longer. So that is my advice for you.
Absolutely. I think the best advantage also, like you mentioned, sir, with the videos is, we provide the MCQ discussion also when we are discussing the topic as well. So it helps them to, hone their skills for the MCQ practice as well, right from their prof years itself. I think that's a very much added advantage if we compare them to the standard textbooks as well.
Yeah, because when we started studying in second year, we didn't know what to study. So the videos will help you what topic you need to concentrate on more and what you need to understand the basic concept that will be helping from this video. So that is the message we can take.
Yes, absolutely. Going on to the next one. So do you think that, a student who starts watching the videos right from their, like, let's say the first year, the second year, they get an extra edge over the students who realize, maybe during their final year or internship, oh, I haven't watched the video lectures. So what's your take on that, Dr. Preeti?
How important on a scale of 1 to 10? I would say an 11, if I can say so, because that is how important it is that you start watching the video lectures from your second year itself. Now, that is again something which many students do write to me, and I'm sure they've written it to you and to Bharath sir also, that are the video lectures recorded in a manner? Are they only for NEET PG, INI aspirants, or are they also for second year students? Because second year students are looking out for the basics. If I have started teaching cardiac enzymes right away, they would initially want to know what is angina, what is myocardial infarction, what are the ECG changes, and then they will want to come down to knowing, the different cardiac enzymes that I'm talking about. So are the lectures arranged in that manner? And the answer is a definite yes, because if you go through the lectures, they are in depth. They have been dealt in a manner that even a NEET PG aspirant can go through them, and a student who's never ever read pathology or microbiology earlier, a same student can also go through those lectures and start building the foundation. The building blocks are definitely provided. So you have to go through the video lectures, and that's just not because it's going to give you knowledge, but it is also going to save a lot on your time. Now, when you start reading Robbins or, Anantarayan for path and micro respectively, if you start reading them on your own, the amount of time and effort that you would require to put in is going to be 100 times more than simplifying that, getting the crux of the matter and reading it from a video lecture. So that is going to save your time, your energy, and is going to give you double the outcome of what you are actually expecting. So as a second year student, in fact, Dr. Yash and a lot of others had also written it in the chat box right now, that should we be, going through these lectures in second year, if we are, say, aiming for INI-CET from day one, and if you have that aspiration, this is exactly where you're making your building blocks. And all of us have seen the video lectures, ma'am and sir, you would also agree. All of us have seen the exam pattern right now, that it's no longer limited to that this question is from Pharmac or this question is only from Path or only from Radiology. It's an integration that is coming up. And if you feel that you'll directly go to final year, read medicine, surgery, and crack the exam, that is not possibly going to happen. You'll have to integrate, come back to your basic sciences, come back to your first, second, third year. You'll have to integrate the question. And then as a holistic thing, you're going to get an answer to it. So video lectures from day one, you have to do for knowledge, for saving on your time and your effort. And also when you go to your final year and you're preparing, you won't have to get back to the lectures. You'll have a set of notes already ready. So that is again going to be something that will help you a lot in the long run also.
I mean, that's great. And isn't it amazing? Like, a student who's watching the lectures in second year, like you mentioned, let's say cardiology. So they have the final year videos also there in the same place, in the same app. So they can actually integrate with medicine right there, with physiology right there, right? They don't have to wait for the lectures happening in their college. When we'll go to final year, the lectures will happen and then we will read these topics. I think that's a very much added advantage. You read it in a integrated way right from the beginning, like especially when the next is going to come in place. So I think the students have to do it in their respective prof years itself. They cannot wait, like the present scenario, internship, we will prepare for our PG entrance exams. Right. Bharath sir, what is your take on that? How pharmacology basically helps us to build our foundation, for the clinical subjects, because we know that it's very, very integral for medicine.
Yeah. So it's a valid point what we are going to discuss. And let me take our example when we were doing MBBS in second year. Because why I compare this? Because now you have advantage of video lectures. At that time, we didn't have this. So at that time, second year used to be for 1.5 years. Time. And we only concentrated during internal. So whenever we studied for internals, we used to remember that time. And after that, we will forget. And second year later, after second year, we forgot the drugs also. So when we came to final year and then we started preparing for entrance, then we thought how much time we wasted and we have not built the concept. To again build a concept, you have to prepare after MBBS for 1 year, 2 year, 3 years, depends on your capabilities. So the advantage of starting in the second year is you are building a concept already. And with that, if you put the revision again and again, do the Q banks, do the revisions. So you are already prepared when you are out of MBBS, you are already prepared to crack any entrance exam. That is the reason why you have to start doing this videos in the second year itself. Yes.
But one question that I'm curious about. I also want to know, like, is it like Dr. Preeti, you love pathology in second year and you're all like, "Nee, mujhe MD pathology karna hai. I love Robbins." And Bharath sir, same to you, like Pharmac was your favorite subject, or it just happened, with the flow.
Okay. So should I take that first?
Sure, please take it.
Yeah. So pathology in second year was a subject that I liked, but nowhere in the, as the most vague thing that I have in mind, that this is something which I am going to select eventually as a long-term plan over many clinical subjects. So honestly, like every other student, a lot of students write to me that, "Ma'am, you must have been God gifted that you could understand the pink and the blue and all those slides from day one. trust me, we have also struggled in the same manner. I also had the same issues in second year. I could not focus the microscope the day I entered the pathology lab. I could not focus my binocular vision into the microscope. Like all of you, we've struggled. We could never understand the pink and blue. We have also had those, the cheating methods and cheat codes where our seniors used to tell us that the slide that is broken is lipoma. Or I still remember the slide labeled as 300 in our department was lipoma. So we all have gone through that phase where we did not understand pathology as a subject, because it is not something that you get overnight, or you can just read a textbook and you can get the tricks of doing the subject. So honestly, at that point of time, I liked it theoretically, but practically we did not have that much of exposure. I still believe in the MBBS curriculum, not much is actually told about what pathology as a subject is while you're pursuing your MD and when you take it up as a lifelong career, because we are exposed to very limited, like 50 slides, and everyone believes that pathology is just about 50 slides that you have to see, and that is what a pathologist does, and 4 o'clock shuts the department and goes back home. But there's a lot more to the subject, which I gradually gathered once I got into my MD. So yes, this is something which came gradually when I got exposed to all the subjects in my internship, where I knew that this is the kind of lifestyle, this is the kind of work-life balance, and this is the kind of, minimal patient interaction. And these are the things that I wish to prioritize in my life. And that is the reason that I'm selecting pathology over a lot of other clinical branches, which I did not want to pick up. So definitely in second year, I was not at all thinking of taking the subject. And this happened as I gradually came to internship. So many students who are struggling with their slides, trust me, what you're seeing today as me sitting in front of you as a pathologist is the final outcome. But the last 15 years of second year MBBS till date are pretty much like how you are struggling with the slides, and we've all been through the same phase practically.
Absolutely. And I think every student here must be feeling so grateful that ma'am ne pathology liya. So like we have the best educator for pathology and we don't have to struggle there.
Thank you, ma'am. Thank you.
And over to Bharath sir here. Pharmacology, was it your favorite subject?
No, not exactly. It was my favorite subject, but it was a part of curriculum. That's what I thought. And I was in the second year, I was scared with pharmacology because I think you all agree with that. The volatility of the subject. So you read the drugs from morning, and after 4 or 5 days or after 15 days, if I ask you what is the difference between albendazole and metronidazole, you tell they are both. So that is the kind of thing what pharmacology can do. But the way we build up the concept and learn the things and understand the differentiating features, how do we differentiate the drugs, and what most important thing we need to understand with this, that will help us to crack any exam, university exam, NEET PG, INI-CET, FMGE, whatever exams we can crack with that. So then gradually we started learning, and when we started doing our MD in pharmacology, we understood why they were asking this question, why this drug was important, why the adverse effect was important. Then as we started teaching students, as we started treating the patient, we understood the importance, why the drugs are important. And then we go back and refer to the drugs, and we understood the subject beautifully. So now what you have the advantages. Now if you want to know the disease, you can go to the videos in medicine, OBG, go there, see there, and you can come back to pharma and learn the drugs here. So the beauty is you need not go to fourth year and learn the things and come back. So you can do it in the second year only. So that is one advantage. You all have that, and I think you should take the privilege of it.
Yeah, absolutely. True, sir. I can't agree more to it. So we have Mehul here asking, is this relevant for BAMS? Absolutely, Mehul, if you are reading patho, pharmac, and microbiology in your curriculum, irrespective of which stream you are from, I mean, this is definitely going to help you. Right. Now, the next question that we have is, so do you think when a student is reading their respective subjects in the second year, there's a particular sequence of topics that they should be following? Right, because we see that students don't get a lot of orientation about this. This is how this topic is going to build the foundation for my next topic. So Bharath sir, what do you think is the sequence of the videos or the chapters, the topics that a student should be doing while doing pharmacology?
Yeah. See, whenever I referred the standard textbooks and the Indian author books, I saw that there were the sequence of topics were different. So then what we did is, when we started recording for the PrepLadder, we maintained the sequence of videos so they can understand and they should not miss the first. So what I started with is general pharma, where you understand how the drug works, pharmacokinetics, and all those things. The first topic will be general pharma. Then after that, you need to understand autonomic nervous system, where you understand the cholinergic, sympathetic, parasympathetic, sympatholytics. Without understanding the ANS, you cannot understand the CNS, CVS, RS topics. So that's the reason why we have made it in a sequence. And we have arranged the videos in the sequence which you have to learn. So no need to worry for that. We have already arranged them. So first is basically general pharma, then ANS. After that, you can go with the renal, CVS, CNS. So these are all interconnected subjects. So along with that, you can, my most important thing I want to point out here is when you are doing microbiology, you will be knowing the bacteria, you will be knowing the parasite, protozoa. At that time, if you read antimicrobials, memory will be longer and you can recall it faster. Now, the questions, as Dr. Preeti was telling, it is an integrated question. They will give you viral test positive, what is the drug of choice. So first of all, you should know what is viral test, where it is positive. Then only you can write what is the drug of choice. So that is why when you integrate and learn whatever type of exam, whether it is a next exam, INI-CET, you can correct them. So that's the importance. One is to arrange the subject in the sequence manner, that is the topic wise, and integrating them with the subject. And again, I am telling you, when you are studying pathology, you will come across cancers. At that time, try to study the anti-cancer drugs. So that will make your preparation easier.
So basically the takeaway point is, so pathopharmac integrated and micropharmac integrated, that's the way to go about in the second year, basically to build the foundation.
Yeah. I mean, for certain topics, what I told, like microbiology with antimicrobial drugs, and for cancers, anti-cancer drugs, you can go with that. But certain topics are horizontally integrated. That means when you're studying CVS, CNS, you have to integrate with medicine. When you are studying OCP, oral contraceptive pills, or estrogen progesterone, you have to correlate with OBG. When you are studying ortho, you have to correlate with the drugs used in osteoporosis, calcium metabolism, and drugs used in rheumatoid arthritis. When you are reading ophthalmology, you have to integrate with the drugs used in glaucoma. So the integration should be both horizontal as well as vertical integration. That will help.
True that. And I think that's possible only with the PrepLadder app, because it's not possible in the college, surgery faculty, medicine faculty will come and then the pharma faculty will come. So that's only possible with the videos.
Actually, NMC has drafted a guidelines where every department should integrate and do this topic. But I work in a medical college, I can see that, but there is no integration there. So here they can get that integration and take the advantage of it.
Absolutely. Over to you, Preeti ma'am. What do you think would be the sequence in pathology? Is there a particular sequence, or a student can jump like from whichever topic they want?
No, ma'am. Actually, firstly, there are two things. The way the lectures or the way the chapters are arranged in Robbins, exactly in the same manner for pathology, exactly in the same manner, the chapters are arranged in the PrepLadder video section as well. Be it the main videos or even the rapid revision for that matter. Everything is arranged exactly how it's arranged in Robbins. But when it comes to microbiology, this is something which a lot of students have also written to me, because there is a change in the curriculum for microbiology. Because the way the lectures are arranged in the PrepLadder app, they are in a manner of general micro, then all the bacteria, viruses, parasites, fungus, and so on. Whereas the way it is written in their textbook is more systemic. Now, while we do understand that a lot of systemic approach is followed only till your university internal exams, because most of the colleges in their final university exams are following the same pattern as what we have given in the PrepLadder app. Further on, your NEET PG, INI, and every curriculum is also following whatever is given in the PrepLadder video section app. Only that systemic thing that students are a little worried about, that is being followed in the internal examination of the respective colleges. And for that also, it's very simple. Like, for example, you are reading about meningitis, or you're reading about a particular system, right? You're reading about the cardiac infections or CNS infections. So you might feel that under that Neisseria meningitis is written, Haemophilus influenza is written, but ma'am has not taught it in a manner of CNS infections. She has taught it of meningitis. She has taught Neisseria under cocci, Haemophilus is given under the bacilli section. So how are we supposed to integrate it? If at all you face that concern in your internal exams in the first semester of your second year, then in that case, just pick up, like, for example, you're reading meningitis, you come across Neisseria meningitis, go to the respective video section of the PrepLadder app and read about Neisseria meningitis. Next, you come across Haemophilus influenza, go to the respective video, because we have timestamps. It's not that you're going to waste too much of time, and it's not that it will require too much of effort to search where in 40 hours or 50 hours is Haemophilus given. Everything has a timestamp. You just need to click on that particular thing, and you're going to come across, you know, the final bacteria that you want to study. And this is something which is an effort you will only have to put in for your internal exams, because your final university, NEET, INI, everything follows the same pattern as what we have given in the PrepLadder video. So the sequence is definitely sorted for you guys. And coming to the second part, I think mostly Bharath sir has answered that, whereas when it comes to integration, I believe 3 subjects of your second year, Path, Micro, Pharma, are integrated in themselves only. I mean, nowadays, most of the questions, for example, that we're getting on malaria, you might get a picture of malaria, how to identify the trophozoite and schizont from micro, but then the question is asking you about the anti-malarial drugs that you have to give maybe for cerebral malaria or for Vivax or so on and so forth. So that is an integration which automatically has come up. Another thing that has come up is fungal organisms in micro is very important. Similarly, antifungal drugs, they are asking you side by side when it comes to pharmacology. So this aspect of integration, you can settle it in your second year itself, and you don't have to do much. If you're reading mycology and microbiology, mycology fungus section, you just do the antifungal drugs from Bharath sir's lecture, and you've automatically done that integration. You don't have to worry about it maybe in your later years or going forward. So this amount of integration is settled here. The next level of integration would obviously be with your final year subjects, like a medicine or a surgery, like Bharath sir has just explained. And that mainly is for your systems, like you're doing arrhythmia. So you need to, you know, study about arrhythmia from medicine and antiarrhythmic drugs from pharmac. So that is an integration which is possible because you have access to all the video lectures. And, you know, that is a little bit of effort, that dedication that you need to put in, because you know that the pattern is no longer fact or one-liner based. The pattern is about getting an entire answer. So, yes, these are the 2 things that I just want to put across.
All right. And if I may ask, you know, how many hours is complete pathology, microbiology, and pharmacology in the app, right? We have 1.5. We have 1 year for second year. I think students can actually complete the syllabus within 1 month, considering the time span we have. So if you could let us know that how many hours it is, both in the main videos and the rapid revision videos.
Okay, shall I take the question? Yeah.
Yes, sir, please.
Okay, so my lecture videos, main videos are around 70 hours. But since I have written everything in the lecture videos, it is taking 70 hours. But what I recommend for the student is watch it with 1.25 or 1.5x speed. Then the duration will be around 50-55 hours. So I think you will complete the pharma. But if you are slow learner, no problem. You can go with the same speed. But if you have learned, if you want it faster, you can increase the speed. That is one thing you can do with that. Yes, Dr. Preeti.
But I think so with that, that means that even if it is just 1 hour and 50 to 55, maximum of 2 months, and sorted with the pharmacology, even if it's just 1 hour.
Yeah. The thing is, that's what. See, whatever you do the videos, it's most important thing is revision. How much revisions you are doing. So you are going to reproduce it back. So revision is very key point. And also the revision lectures I have made for 8 to 10 hours. So that is the duration we have done that. So once you have done the main videos, revision will be easier for you. Within 8 to 10 hours, you can revise it. So we have made your life easier. So don't worry.
Yes. Coming to you, Dr. Preeti.
Right. So, ma'am, when I was recording the video lectures, I had 2 set of students in mind, because we ourselves have gone through both of these phases. That when we start off with a particular year, it's like the first of every month, right? We are very motivated, and we believe that we are going to cover 100 hours of video lectures in no time. And, you know, we are at the peak of our motivation. So obviously the full course videos are designed in that manner that not any single topic should go missing or should go untouched. So pathology pathology is 75 hours and microbiology is 47, 48 hours approximately. But then I've also kept in mind the students who probably, for whatsoever reason, have not been consistent from day one, and they have a pre-prof or they have a prof exam, say in 1 month or 2 months time, and it is humanly not possible to cover that bulk of lectures. So for them, we also have rapid revision. Now, rapid revision for pathology is 19 hours and for microbiology is 15 hours. And this has been covered in a manner which I don't think most students have told me that main videos we can easily watch on a 2x speed because the speed in general is slow, but the rapid revision in itself is a little rapid as the name suggests. So you can possibly try at a 1.25 or 1.5x speed, but trust me, most of it has been put. It's not that the content is missing or content is less in the RR videos. It is just that everything has been concised and put together in tables. So what you were reading as 10 pages now becomes one table. Like for example, ovarian tumors comes as a long question for students in their university exam. And you have to fill like say 7 or 8 pages. If you go through the main videos, you will find 7, 8 pages, content for 7, 8 pages. But when you come to the RR videos, all of those 8 pages have been put into one table of ovarian tumors. Now, even if you read that, you can use your talent and expand that into 7 pages in the exam. And all of us are guilty of filling too many pages in the exam just for getting marks, right? So even the RR is not something you should be going from day one, but RR is going to be your savior in times when you don't have too much of time in hand to give, say, 75 hours of pathology or say 47 hours of micro. You cannot give in that much of time. Then, of course, you go to RR, but that should not be an escape. Doesn't mean you don't study for the rest of the year. The ideal and the best method would be every day start going through 2-3 hours of video lectures after your college. And even if you go through them, even Bharath sir will agree, the main videos are not very fast. You can easily speed it up to 1.5x and you can, speed it up and cover it a little faster. So, of course, the main videos are going to be your mainstay for every exam. But for students who probably have come to know about PrepLadder a little late or have joined in our lectures a little late, then for you guys, RR is something which can definitely save you.
Yeah, I think that's the beauty of the PrepLadder app. It caters to every type of student, the ones who are like very studious and the ones who are like the last minute students. I think that's the beauty of that. Yeah. Going on to the next one, like Bharath sir mentioned that most important after watching the videos is the revision. And I believe that QBank is the best way basically to understand, assimilate, and apply the knowledge that we are learning from the videos, right? So, sir, what do you think? What should be the approach of solving the question bank when the student is watching the video lectures in their second year as well?
Yeah. See, every time when you start doing pharma videos, first you see a topic. So once you finish the topic, what I suggest you is try to memorize that. How much ever you can memorize, try to do that. Then once you have done that, try solving the question bank. Now, question bank will tell you how to analyze the question, and you will also develop the reasoning skills, and also you will analyze the integration skill. That's what we are discussing. For example, they had given the malaria parasite, and they'd asked the drug of choice for the treatment of malaria or something like that. The integration skill you will develop. The next thing is whenever you solve a question, there will be 4 options. So I always suggest that, yes, you will get a right answer, that is fine. But what about the other options? Are we analyzing that? Where does that option come? Are we understanding that? Are we ruling out those options should be important. So that's why any question, all the 4 options should be thoroughly analyzed. That is the most important thing. And then the next thing is, this is like a reboost. Whatever you have studied, what you have revised will be a booster dose for you. Like vaccine, what we tell it as booster dose, question bank is a booster dose. And in our PrepLadder question bank, at the end of these questions, we have the learning objective. So from this question, what message you are taking, that can be taken from this question bank. So please start doing this question bank from second year only, because whatever exam you take, you want to crack NEET, PG, INI-CET, FMGE, whatever exam, the pattern of question is MCQ based. Either it may be one-liner. As the days go on, it may become case-based, but penultimately you will be left with 4 options. So nobody is going to ask you essay-type questions for competitive exams. But for university exam, yes, it's a essay-based question you will write. But question banks, to secure a NEET PG seat, it's very, very important. I hope you find this point valid for you. Thank you.
Absolutely, sir. I believe that the major gap that happens during the preparation phase for students is they haven't practiced a lot of MCQs during the prof years, all the time preparing for university exam. But then when they come to the NEET PG, INI, FMGE preparation, they realize, oh, it's all MCQs and we never did that. So the earlier they start practicing the Q bank, I think the earlier they would learn the skills of ruling out the options, the logical guessing, right?
Yeah.
Scoring more even when they're not very sure of the answer. Basically, they would learn a lot of skills. And of course, like you said, learning objective is the best part, giving the summary of the topic at the end of the question. That's the best part.
One more thing I just want to add. Many a time students tell that, sir, this topic is boring. I'm not able to concentrate. So I tell them, start solving MCQ. When you start solving a MCQ, you will understand whether you know the concept, whether you know the answer for that. Once you go wrong with 4 or 5 questions, then you will understand what you have to study in the video. So that is one more approach you can come. If you are not able to solve that question bank, you will go back to the video and see that. So that is one more help you will get it from the question banks.
And I think the best part we have on the PrepLadder app is every question is linked to the respective video lecture, to the respective treasure as well, a summary table which is provided. So I think we have given everything on the platter for the students. You don't have to do any efforts except from studying. That is what you have to do. Everything is there just on the platter. Yeah. Going on to the role of the notes. Right. Like I said, I'm very, very envious of the students of this era. They're getting everything ready. I think we very much remember how we used to make our handwritten notes, and we used to struggle so much. Ek lecture bhi miss ho gaya, yani notes chale gaye. This is how it used to be. But now students have everything ready. The notes are ready. So Dr. Preeti, coming to you, what is the best way the students can use the notes for their prof exams? And also at the same time, in their second year itself, preparing for the NEET PG or the PG entrance exam, basically highlighting from the Q bank, the PYQs. What do you think they can make the best use of notes? How?
Right. So, ma'am, the students, if they have been with PrepLadder earlier also, they might have seen this change in this year's PrepLadder 5.0 edition. Is that, the notes are not just written, of course, they are bulletized, but they're not written in single words or say 2-3 words per bullet. It is written in a manner that someone who is only even reading the notes without assistance of the video lectures at times can still understand it, because it is written in a bullet manner, but yes, in a sentence form, so that you have continuity in that question, or you have continuity in the notes. That is one added advantage, which will be especially important for the university exam students, because this is precisely how you have to write your answers. You can't write one word for the examiner to check and come back home, right? You have to make a flow chart. You have to make an entire continuity in your answer in order to get marks. So that is one thing, how the notes are going to help you. And the same notes, when you're, of course, see, you're not going to learn it. We are no longer in school where we learn word by word and alphabet by alphabet. We, of course, learn the buzzwords and we make it into our own sentence when we write it in the exam. So those buzzwords that you are highlighting, if I would have been in your place, I would have highlighted the buzzword of every page, and say, for example, in a particular page, I have highlighted 10 buzzwords. So those 10 words will help me in solving my questions if I am a NEET PG aspirant, and the same 10 words will help me in making a sentence-based answer if I am a university exam aspirant. And one thing for the second year students, which is important, is whichever exam you give, there is an art of even attempting a question paper. If you are appearing for your university exams, there is a particular art of writing answers over there. You must have seen, and let's be honest, students who have a better handwriting, better presentation, who put in more flowcharts, who put in more diagrams, who are more expressive in their question, in their answer sheet, they automatically end up getting more marks, right? Because that is more appealing to read and more easy to read. If I am an examiner and if I have to read a question or an answer, it will be more appealing if it's written in the form of a flowchart than in the form of a paragraph where I am searching for everything. So this is exactly how the notes of PrepLadder are also arranged. We have flowcharts, we have bulletized points, we have diagrams. So as it is, if you try to copy paste that in your university exam, you're anyway getting marks out there. We are settled out there. And the same thing if you try to put into your NEET PG preparation, whatever buzzwords we have certain points which are highlighted. We have boxes which are made in our notes. We have treasures which are there in our app. Now, those are the buzzwords which will help you solve your MCQs. The only extra thing that you can do possibly is, as you're listening to the video lectures, if the teacher has possibly given you, say, an extra way of learning or a mnemonic or a PYQ which might not be mentioned, just keep adding that onto your notes. That's the only effort that you possibly need to put in now, but the same set of notes will help you for your university as well as for your MCQ based exams also. So as you started off, ma'am, we are definitely envious of this era where students are getting notes, because trust me, making notes was one of the most tedious and most effort and time consuming thing that we had in our way back in our times, where making notes, making pretty notes, beautiful notes, aesthetic notes was one big deal for everyone. And that is why there was a set of students who used to make notes, usually girls, because they had better handwritings and more artistic skills with many color pens. And then how everyone in the class used to get them photocopied. So at least a lot of that effort has been reduced now, because we have equivalent notes pre-prepared for us, right?
Yeah, and to add on to it, Dr. Preeti, I'm envious of you as well. How do you make so beautiful notes? Like even in the lectures when you write, I mean, such beautiful handwriting. I always wonder, itni achhi handwriting kaise? Did you have that handwriting right from the beginning, or you have consciously developed it?
No, a lot of people do tell me that being a doctor, you're not supposed to have a good handwriting. So I think that is one of the rare events that I have witnessed myself in my life. And honestly, I did not have a very good handwriting, because not only was I destined to be a doctor, so also I am left-handed. So lefties usually have greater difficulties in writing, which makes their handwriting all the more a little difficult to read. But I would give this credit to my first teacher, who's my mom, who's genuinely worked a lot on my handwriting as I was a kid, and who genuinely made a lot of effort. And I think today, as you say, that if my handwriting is good, all the credit goes to her, because she's put in all that effort when I was a child.
Yeah. I mean, does she take handwriting classes? I would like to join that.
No, I know you told me this off camera also a lot of times, that, this is something that I want to learn, that handwriting is, but I think, you don't need a good handwriting, because the way you communicate to students, that is good enough, and no one's wanting the good, pretty notes from you, because your mnemonics are only so good and they stay in the mind for so long that handwriting becomes a secondary thing.
Yeah, but I write in such a way that later even I'm not able to read, so they cannot read from that. That's the only part I need to.
That's a part of the trade, because all doctors have similar handwriting, so it's okay. It goes well.
Yeah. True that. And like you mentioned, so Bharath sir, do we also have a lot of summary tables and all in our pharmacology notes as well, where we compare and contrast the drugs with their mechanism of action, the adverse reactions?
Yeah, see, that's what PrepLadder notes has. So we have compiled what's the important thing for unit exam in that notes. So writing notes, I agree with Dr. Preeti madam, whatever she has told. We agree with that. So notes writing is a tedious job. But now the new generation have the advantage, so they can see the notes and learn it easily. But I still remember when I was in second year, my roommate used to do the notes, and I used to study from that notes, and I used to score more than him. The point here is, when you study that, how do you present? So university exam is the presentation skill. So the flow chart, how do you put the pointers? That is important. Suppose if they ask you a question and you write like an essay, and no examiner will be interested in studying that essay. So if you put a flow chart, if you highlight some points, that will carry more marks. So that is how the presentation skill is also more important. So prepared notes, one thing is that saves the time, and it will give you a pictorial memory, and also you can add certain points what you want to add for the notes that is already there. So the point here is making the notes takes time, because you need to understand the subject, then you have to write it down, again you have to revise it, it takes time. And one more thing is, earlier I told you it was 1.5 years for second year. Now it has reduced to 1 year only. With that 1 year, you have to do 3 subjects, and making a notes and studying them will be difficult. So PrepLadder has made it easier for you. Yeah.
Yeah, true that. And I think the feature that we have added in 5.0 notes, that is the crosswords, trying to add a bit of fun learning. I think we have tried our best to make their studies fun as well, along with the routine studies that they are doing. Coming to the importance of treasures, we've also updated the treasures in the app, like we can see on the screen as well. We have made it like more detailed, sort of thing that the entire topic has been covered in the treasure itself. So basically, I would say like if somebody has to write a short note or even a long answer, the treasures can help there as well. And also for the Viva exams, last minute, अंदर जाने के पहले कुछ याद आ गया पढ़ना है, and they hunt for a treasure and they quickly revise it. Right? That is one way I think that the treasures can also be used by the prof students. What do you think are the ways that using the treasures can help the students? Dr. Preeti.
Ma'am, I believe treasures is going to be something which is important for them when they are on the go, because a lot of students write to the faculties that, I'm traveling somewhere or I'm in my internship, I'm in between duties and all of that. And, when I have limited time, say 15-minute breaks I'm getting in between sample collections or whatever part of internship I'm in, what am I supposed to do in that time? Or maybe I'm, in their second year, they've gone in for some practical. So in that limited time, what is it that they can start and they can complete? They can, of course, in 15 minutes break, they can't see a video lecture or they can't sit and solve 100 MCQs. Treasures is something which is going to be their buddy on the go, because whenever they want to start and finish something in 15 minutes, they have a few treasures that they can go through. So they will not realize, but in a very limited time, they will be covering some of the most volatile and important topics which are needed for their preparation. So it's a revision which is just happening without putting too much of effort into it. And we all agree, like since sir would agree, you would agree, when we make lectures, making things concise is the biggest challenge we face. How to concise one entire chapter into one page. Now that's a challenge, and that is a challenge that we have accepted, and we have put it up in the form of a treasure that, if there's a complicated topic, we'll make it simple with the help of a diagram and a flowchart and a table, and we'll give it to you in the form of a treasure, so that you, again, our main motive is that you put in least amount of effort and time and get double the outcome out of it. So my, my terminology for treasures is always that it is your study partner or your buddy on the go who's going to help you in between those small breaks and will help you revise everything.
Yeah, true that. The students will also not realize, and their peers will also not realize कि ये लोग ये पढ़ रहे हैं. Generally वो जब हम MBBS years में तो ऐसा होता है कि you are studying, you are so studious. इसमें ऐसा होगा कि you're looking at the phone, everybody is thinking कि time pass कर रहा है, but in the meanwhile you are basically getting an extra edge as well.
Correct.
That's great. Yes, Bharath sir, what's your take on that? How can the students use the treasures in the best way?
No, the treasures, before I come to the treasures, so earlier what we used to do when we prepare for entrance exam, we used to write it on a label, whatever important points, and we used to stick it on the wall. So every day when we walk through that, we have to come to the wall, see that. For example, pharma, I had to see the classification of the drugs, major adverse effect of the drug. So every time we had to do all these things. For doing that for 19 subjects is a difficult job. And what is important, what is not important, we may not be known. So treasure is one point where that you can get most important points in your touch of the hand. So you can see everything and the preparation will be easier. So whatever difficult thing, for example, if they ask you drugs causing more toxicity, you have that there. Or if they ask you name 3 antihypertensive drugs which are safe in pregnancy, it is there. So whenever I take Viva exams in the medical colleges, I ask them name 3 antihypertensives. So they stumble to tell. Right, but there are some people who will answer very well. So these classifications or whatever the most important things, what you need for your preparation will be in the app. And whenever you are bored, you don't want to watch the video, as Dr. Preeti was telling you, it's a companion for you. And as the name itself is telling you, treasures are treasures. So make the use of it.
Yeah, absolutely. And also I wanted to know, like, do you think there are some topics which might, generally are not asked in the university exams? I'm sure that we all agree that when we prepare for university exams, the one very important book or resource that we look at is the previous year questions there as well. University may, because we get an idea ki what are our professors, which topics are their favorite. But then there are some topics which might not be asked in the university exam, but they are very, very important for their PG entrance exam. Basically, they might not be covered in the college lectures, but we have covered them in the PrepLadder videos. So do you agree that there are some topics like this? And if you could name few from your respective subjects, Bharath sir?
Yeah, thank you for raising a valid question here, because when you study for university, basically we'll be studying the basics particularly. And whatever the questions have been repeated in university, we'll be concentrating on that. So particularly certain topics, as you highlighted, antiarrhythmic drugs, it's a higher level of learning. First of all, at second year, you don't know what is arrhythmia. And that time they are teaching you antiarrhythmic drugs. So the point here is certain topics which are helpful for your INI-CET or NEET PG, we have covered separately, like antiarrhythmic drugs, newer drugs. So every year, plenty, 30 to 40 newer drugs come to the picture. And also anti-cancer drug, there is something called target therapy. These are other topics which you need not worry for right now at second year. Concentrate on your previous year papers, whatever questions have been asked. Still, I remember beta blocker was the main question for me when I was in second year. Till today, in the university, beta blocker is the main question till today. Till today, fluoroquinolone is main question. Till today, TB drugs are main questions. The pattern of question in university has not changed. So cracking university exam is not the problem at all. You will crack it with the help of PrepLadder. But certain topics which are required for you, as I told you, antiarrhythmic drugs, newer drugs, anti-cancer drugs, that are also covered, which will help you. And whenever you get a free time, you can go that. So that's my take on
that. Dr. Preeti, what's your take on that?
Yes, ma'am. Certainly, there will be a set of topics which are important for university exams and for NEET PG. So both ways. The videos are covered from a point of view that both these exams we are able to take forward simultaneously. So for example, when we talk about microbiology, there are a set of, those tail ending chapters that we have, the miscellaneous bacteria and so on, which are not asked too much when it comes to your university exams. University exams focus more on the main cocci and the bacilli, but the tail ending chapters, miscellaneous bacteria, cocobacilli, they are rarely asked. Only if it's a very, very tough paper would someone give that. So, but again, when it comes to your NEET PG, say Gardnerella vaginalis or rat bite fever or tularemia, these are things which are asked as MCQs. So there is definitely something that you can go through your PYQs of your university exams and decide from the video lectures that these are the more important bacteria, these are what I have to cover. Same goes for pathology also. Some very advanced genetic techniques like say RFLP or PCR, Sanger sequencing, or whether we are talking about neoplasia chapter, immunohistochemistry, flow cytometry and hematology, these are not university exam questions. These are all INI-CET level questions. So flow cytometry and CD markers, no one is going to tell you to make a table in your university exams, but we know CD markers and flow cytometry will definitely come as a question in our INI and NEET PG these days. So yes, this is a mix and match that you have to also make depending on your university exam previous year questions. It's as simple as scan through them once. Before picking up your studies, just scan through the last 5-year papers of your university exams and you'll anyway get to know. And even if you look at our video lectures, I mean, if you don't want to put in that effort, if you look at our video lectures, before everything, the teachers have only mentioned that, this is a topic which has been asked repeatedly in INI-CET, or this is a topic which is a little higher edge or high level, or this is an updated topic. So you automatically know that that is not relevant for your university exams. So I think the lectures are complete. They are a full package in themselves. You just need to know what caters to your needs at that point of time. Topics which you need for your university exam, you read only that much. And of course, my ideal advice would be you read everything, because the journey does not end at the university exam. It is just a stepping stone. The journey moves much forward till NEET and INI, so no knowledge goes wasted. If you go through the entire video lectures, they might not help you in that particular year, but they will definitely help you in the long run. So for any subject, I can say from every faculty's, on every faculty's behalf, is that all the lectures cover all the topics, means for every exam that you are planning to sit for.
Yeah, so basically we are busting the myth that, the students have that, PrepLadder app is for NEET PG or INI-CET. Many students have that misunderstanding, but I think we have told them in all the best possible ways that you need to use it right from your first year, if I can say that. Otherwise later on you would regret that kash mujhe pehle pata hota. So that's why we are here to tell everybody, like, please start using all the resources that you have on the app right from the beginning, because it will help you get an extra edge later on, and you will not have to struggle a lot during your PG entrance preparation journey. And one more important feature that I would like to talk about here is, so now on the app, students, we have also introduced the prep vocab feature, which is because when we know that we are new to the medical curriculum, after our 12th, suddenly this jump is there. So there are many terminologies that we do not understand because they are medical terminologies. So what we have done now, we have introduced prep vocab. So you would see the words in the Q bank, in the answers, basically, where they will be underlined, and you'll be able to see their meaning right then and there. You don't have to go anywhere to understand what does that word actually mean, right? So for the students of second year, if you think that medicine, surgery, if I read, there are many terms I don't know, but the prep vocab feature will help you there to understand the terms, right? Basically, it's like a dictionary which is inbuilt in the PrepLadder app itself, basically to give you a complete package that we have, right? So that was about our discussion here, and coming on to the queries that the students have. All the viewers here, if you have any queries of this, anything that you would like us to answer, you would like the educators here to answer, please drop in your query in the live chat. So Shobhi is asking tips on how to utilize QBank. So Shobhi, I think we have already spoken about that. If you've joined in late, we have spoken about that. You can just have a quick look at that. In a gist, I can say that your lectures, the topics, the QBank, basically they go hand in hand. Whatever videos you are watching, solve the QBank as well and make it a complete package. So Dr. Preeti, Meet is asking, should we make main notes as the base or the RR notes?
For the university exams, of course, the main notes are going to be your base, because first, two reasons, very simple reasons. It gives you a foundation, which you primarily in your second year, you need a foundation. You don't need a shortcut. So you need your main notes. And secondly, you have to write subjective exams. You're not there to solve MCQs in your university exams mostly. You have to write a paragraph or lengthy answers, 2-3 page short notes, 7-8 page long questions that you cannot do with the help of just 15-hour lectures. You need a certain amount of content and information to be able to expand on it and write a question. And of course, for your foundation. So for your university exams, of course, you refer to the main notes only. It's like you can say you make that into a mini Robbins, and that becomes your mainstay for your university exams.
Got it. Bharath, so there's one question from a viewer here, Yash, asking that please tell how to start preparing for INI-CET while in the second year itself.
Yeah, that's what for INI-CET, any exam, currently what INI-CET is doing is they are asking from basic subjects. So most of the questions are from basic subject. So stick to the videos, what we are doing with that, and prepare well, do the Q banks again and again, go with the notes. And when you come to the stage of preparing for INI-CET, that is in the final year or after internship, at that time you can add whatever the extra topics, what we told, like anti-arrhythmic, new drugs or anti-cancer drug. The same thing with other subject also, so try to integrate that. So in this, textbook learning is also important, because INI-CET, they test mostly from the textbook learning. So watch the videos, in-depth understanding of certain topics is very, very important. And there are certain particular topics asked in INI-CET, which we will be highlighting in some other video. So go with that topics and do it again and again. That will help you in preparing INI-CET. So Dr. Nikita, you can add some point about that.
Yeah, before I do that, let me ask Dr. Preeti as well, like, do you have any points to add on, ma'am, whether to how a student can start preparing for INI-CET right from second year?
The same goes, ma'am. We need to focus on the main videos. There is no out-of-the-box strategy that we have for INI-CET starting day one. INI-CET also, of course, has a little extra edge questions, but if we look at the last 3-year trend, it is also asking PYQs. It is also asking a set pattern of questions. So all of that we cannot solve if we don't have a certain base in the subject. We cannot suddenly jump to 20 known topics in pathology and that is how I'll crack INI-CET, or 20 known pharma micro topics which will help me crack. That's not enough. We need to have a basic, and if you look at any of the success stories, interviews of the previous INI-CET students who cleared and got amazing ranks, they have always given one thing very clearly, that we started very early. Our journey did not start right in the last 3 months or 6 months. That was only rigorous study. But our journey, our preparation started way back in our med school, where we made a lot of concepts, basics, foundations. We built that very well. And of course, then we moved on to rapid revision and INI specific topics. So Dr. Yash, for your second year, you don't have to keep in mind that I am only going to study for INI-CET, so I'm only going to study high-end journals and big articles with high impact factors. No, that is a wrong approach. You just have to focus on in-depth analysis of your course, of your content, and study that from the very basic possible sentence, from the very first line you start reading, and you get a core concept clear out of it. And then you gradually build on it, which is a process which will gradually come up as you go to second year, third year, fourth year. It will keep on getting built up. But yeah, your second year you will realize, and ma'am, you will also agree, all of us have agreed to it, that when we come to final year, that is the day we realize that, you know, Robbins, KDT, Anant Narayan, these were such nice books because they had so much of information which we did not value at that point of time. We were that time in the FOMO that, you know, when will I come and read Harrison one day, and that is the day I will become a doctor, because we don't realize the importance of these books while we are in our second year. This is a late realization that happens when we go into internship. So now learn from others' mistakes and make these books as your gold standard, and get a very, very strong grip on these books, so that later on you don't have that regret that some golden books were left out in your preparation.
And just one point that I would like to add on is the students can actually start practicing the previous year questions for the respective subjects right from those years. So someone who wants to start early preparation, let's say pathology, once they watch the videos, right, they can actually have a look at the previous year INI-CET papers, the AIMS papers, the NEET PG papers, so that they get an idea that what kind of questions are actually asked in the previous year papers, and they can mark in their second year itself, like this has been asked in a particular year in the INI-CET or NEET PG. So that's how the early journey can actually start. And we have Faraz also here, who's saying that he passed FMGE in first attempt with a score of 209. Even though he was not well and he was hospitalized, but still he made it. And thank you so much for us for that. We are glad and humbled that we could help you in your journey. Heartiest congratulations and best wishes to you for your future journey as well. I think last question that we have here from a viewer, Deepak, saying that this is his second attempt for FMG, and the previous one he scored 146. Right now he's doing RR, the rapid revision. And his question is now whether he should solve the RR Q bank and the previous year topics and the grand test, or should he actually do the whole main video Q bank? What should be the strategy? What do you think, Dr. Preeti, the right thing would be to do?
We need to always make a strategy, keeping in mind, Dr. Deepak, what is the timeline in hand? If you would have had 1 year in hand, I would have, of course, told you do the main videos, main Q bank, and go in a a strategic approach, which we always tell the students. But now we have a certain time constraint in mind, where of course I will tell you that, just reading once is not going to get you that 150 score. You have to read a limited set of information, but you have to read it repeatedly, because revision is essential at this point of time. So RR, QBank and RR notes videos are what you're going to primarily depend on, but there will always come a point in the subject where you'll feel nahi samajh aa raha. You're reading about myocardial infarction, or you're reading about cardiomyopathy in medicine, and suddenly you're like, I'm not understanding the concept. So then don't waste too much of time. Quickly go back to the main video, quickly go through it in half an hour and come back to your RR. Only where you get stuck, over there, you go back to your main videos, clear your concept quickly and come back. And of course, you might have seen that even on the PrepLadder app, because a lot of students similar to your situation, considering the pass percentage was extremely low this time, a lot of students have written to us that, coming back on track is becoming difficult. So we have got a rapid revision elite plan also that is going to begin very soon in September, which is anyway included in your plan, and we will be giving you more information on that also. That will have a lot of daily targets and Q bank, and how as a companion we will be moving forward with you guys. So that is something which is going to come up very, very soon, and we'll be giving you more information in the coming week on that. But a straightforward answer to your question, Dr. Deepak, will be RR notes and RR Q bank at this point of time with multiple revisions.
That was a great suggestion. And yeah, thank you so much for introducing the rapid revision edge that we are going to introduce very, very soon. And I think that's going to be a game changer for the majority of the students who get lost, who do not have a direction. And it will definitely keep them accountable. So all the viewers here, please keep a watch on this channel. We are going to tell you all the details about the rapid revision edge very, very soon. And yeah, before we say goodbye for today, so one last thing, Bharath sir and Preeti ma'am, there's one thing that you would like to tell the students. They have their lows as well. What is your favorite motivational quote, or something that keeps you motivated, or you think that will keep students motivated whenever they have their lows?
That's what, keep dreaming. So dreams will help you achieve the goal. So keep dreaming. You should set a goal, and obviously you will achieve the goal. So without dreams, no goals, no achievement.
Absolutely. And I think that is why we call our students as dreamers.
Yes.
Over to you, Dr. Preeti.
I totally agree with Bharath sir and you, ma'am, that we have our students named as dreamers because it's all ultimately you're doing it. There's a reason why you started it, and that is what you have to keep in mind. And I always tell the students that, watching too many, like Dr. Shobhi Khan also over here is mentioning that, we watch too many motivational videos, and now we've got an abundance of these thanks to the social media platforms. But the half-life of these motivational videos is very short. It's something that you'll watch this morning and it'll maximally give you motivation till your afternoon. That's the only dosage and half-life that it has. So this is something that needs to come from the inside. And whenever you sit down to study, you should always, and I always make students in my offline class also do this, on the first page of your notebook, you should write down whatever is the reason as to why you are in this journey. You are not in a very easy journey. It is not a journey that too many students in our country or in the world take it up. You are definitely unique that you've decided to get going on this journey. So there must have been some reason. It could be personal, it could be your professional growth, it could be your parents' dream, it could be a financial responsibility. There could be one reason which is definitely why you are in this journey, and you should always write that. On the first page, I make every student write it in my offline class also, because whenever you feel that you're down and out and you're not able to go forward, when you read that, it is automatically going to get you back on track, because you know that is a commitment that you have made to yourself and that is something that you have to fulfill. So if you just have that dream, if you have that reason as to why you're going, there will be lows and highs. We still have that. All the faculties agree that even till date, we have our set of highs and lows, which might not show on camera because we probably meet you for 1 or 2 hours in a day, but the rest of the day we have our set of highs and lows, and we also deal with the same thing that you guys deal on a daily basis. But we do keep going because we know at the back of the mind that this is exactly why we started doing this. That's all that you have to remember, and trust me, you would not be needing too many of the motivational videos that you see online nowadays if you have your dream sorted in your mind.
Very, very useful tip coming from both our educators here. And on that positive note, thank you so much, all the viewers here, the dreamers here who've joined in for the today's session. And thank you, Preeti ma'am and Bharath sir, for your valuable inputs and the insights and the orientation that we have given to the students. Thank you so much.
Thank you, Dr. Nikita.
Thank you, ma'am.
Thank you, Dr. Preeti.
Thank you, sir.